If you wake up in the middle of the night and can't get back to sleep, don't worry. In this video, I'm going to teach you the 5 breathing techniques that will not only help you fall back to sleep, but stay asleep as well. Hey everyone, I'm Dr. Michael Bruce, the Sleep Doctor. Breathing exercises are one of the most effective ways to help you fall back asleep in the middle of the night. For one, breathing exercises can actually signal your body to relax, lowering your heart rate and preparing your body for sleep. Remember, your body needs a heart rate of roughly 60 beats per minute or below to enter into a state of unconsciousness. But another big benefit is that these exercises can help your mind have something to focus on, which if you're like me, one of the problems you have when you wake up in the middle of the night is you have racing thoughts, or what I call monkey mind. By lowering your heart rate and freeing your mind of racing thoughts, you will more naturally and more quickly fall right back to sleep. Each of these techniques works differently for different people, so I'm going to encourage you to try them all so you can find one that's just right for you. And if you stick around to the end, I have 2 advanced bonus techniques that I think are game changers for sleep and overall well-being. So before I get into any of the breathing techniques, I want to make sure that you're practicing something called diaphragmatic breathing or belly breathing. So how do you do this? It's simple. As you inhale, you expand your belly, and then when you exhale, you contract your belly. Belly breathing helps maximize your lung capacity and encourage slower, deeper breathing. Also, while you're doing this, make sure to be breathing through your nose, not your mouth. Breathing through your nose produces something called nitric oxide. This is kind of an internal gas that helps dilate blood vessels and improve oxygen delivery to all of your blood cells. Let's go to our first breathing technique. This is called cyclic sighing. This is one of the simplest breathing techniques, so it's the one I like to start with. I personally use this one all the time. You start by just inhaling through your nose and you continue to inhale until you can't take in any more air. Then without holding your breath, slowly exhale and let it all out. Kind of like this. This can be a great place to start if you're struggling to fall back asleep because it can help relieve stress very quickly in like under a minute, and it's a good way to practice diaphragmatic breathing. Oftentimes, just doing a few rounds of cyclic sighing is enough to help break me from my monkey mind and begin the process of falling back to sleep. The next is a technique called box breathing. Box breathing is also one of the easier breathing techniques out there, but it also has the benefit of helping you focus your mind a bit more than cyclic sighing, partly because you are now going to be counting. Don't worry, the math is easy. Box breathing consists of inhaling for a count of 4 seconds, holding for a count of 4 seconds, exhaling for 4 seconds, and holding for another count of 4 seconds before breathing back in and repeating the process. So it kind of looks like a box, right? But when you do this, I want you to picture the number in your head. So picture a 4, then a 3, then a 2, then a 1, then move on to the next stage. If you're new to box breathing, try it for maybe 4 to 5 cycles to help you fall back to sleep. As you get more experience with this technique, you can try increasing the round to between 10 and 20 cycles, which will take around 2 to 5 minutes. This is also one of those breathing techniques that becomes more effective the more you use it. So what you could do is practice it during the day, and when you wake up in the middle of the night, your body will be attuned to this technique, and therefore you get a little bit more bang out of your buck. If you're interested in getting better sleep, please do me a favor and subscribe to my channel. I've got a bunch of great content coming out soon that you're not gonna wanna miss. And if you're finding this video helpful, give it a like. Your support helps allow me to create more video content just like this. And while you're at it, if you get the time, go check out my website, sleepdoctor.com. It has tons of sleep content, articles, and even a shop. I'll leave the link below in the description. Okay, the next technique is really good if you're experiencing any negative emotions in the middle of the night. So this is called alternate nostril breathing. I call it hang 10 breathing because you're gonna do the old hang 10 sign, and I'll show you why in just a second. While simple to execute, it's a powerful practice that can really help calm you down if you're in an emotionally agitated state. This technique is believed to harmonize the left or logical side of your brain with the right emotional side of your brain, promoting some level of mental clarity and emotional balance. What you do is you exhale completely before starting, then you use your right thumb to close your right nostril, then you inhale through your left nostril, and then when you close your left nostril, you just flip it around here, put your pinky on here, and then breathe in like this. As a beginner, you should aim to do 5 to 10 cycles of this. As you become more comfortable with this alternate nostril breathing, you can actually increase the amount of time that you're doing this. The next technique is similar to box breathing, but is a little more advanced and can be very effective. It's called 4-7-8 breathing. And I really think of it as kind of the gold standard of breathing exercises. It consists of, while picturing the number in your head, inhaling for 4 seconds, holding your breath for 7 seconds, and exhaling for about 8 seconds. This is also a technique that works best when your body is used to it. I would recommend practicing this one at least twice a day. In fact, practicing it before bed is an awesome way to prepare your body for sleep. I will be honest, some individuals could experience a little lightheadedness or dizziness, especially when they're first learning this technique. If this occurs, reduce the number of cycles per session and gradually increase as your body adjusts. And if you're having trouble holding your breath the whole 7 seconds, you can actually reduce that time as your lungs adapt. Now let's discuss our 2 bonus techniques. Now, this next one isn't actually a breathing technique, but it's an awesome way to fall back asleep in the middle of the night. It's called Jacobson's Progressive Muscle Relaxation. So Jacobson's PMR involves systematically tensing and relaxing different muscle groups in the body to induce a state of relaxation. Now, to prepare for this technique, I usually have my patients find a quiet, kind of comfortable space and wear loose, comfortable clothing. Fortunately, if you're lying in bed in the middle of the night, you're basically in the right environment. Now you'll start with your toes. Tense your toes slightly for 5 to 7 seconds and then relax. Notice the feeling of relaxation. Then what you're gonna do is you're gonna work your way up your body. You repeat this process with other muscle groups, such as your feet, your calves, your thighs, your glutes, your abdomen, fingers, hands, arms, shoulders, neck, jaw, and even your forehead. Each cycle of tensing and relaxing a muscle group should take you about 10 to 15 seconds. On to my last technique. This one is actually very energizing, so it won't help you fall back asleep in the middle of the night, but I wanted to include it because I think it can be a great thing to do first thing in the morning if you had a really sleepless night. It's called the Wim Hof method, and you may have actually heard of it before. This method induces an energized feeling of increased oxygen levels and stimulating the sympathetic nervous system. This leads to a cascade of physiological responses, including increased adrenaline and a feeling of invigoration. My son and I actually got to meet Wim Hof, where he taught us how to do this. First, you find a comfortable position, either sitting or lying down. Close your eyes and try to quiet your thoughts. Now, you take in a deep breath, inhaling deeply through your nose, and when you can't inhale anymore, you let breath out of your mouth without force, kind of like a cyclic sigh that we were talking about earlier. You do this actually 30 times in a row. And then after you complete the very last breath, you exhale all the air out of your lungs. Now you hold and resist the urge to breathe for approximately 30 seconds. Your body's gonna be fighting this and telling you to breathe, but try as hard as you can to get to 30 seconds. Once you've passed 30 seconds, you can now draw in one big breath, letting your stomach expand, hold it for 15 seconds, and then let it go. I have a tendency to do this every morning after my morning meditation, and wow, it's a great way to start my day. So the next time you wake up in the middle of the night, these breathing techniques can be a great way to fall back to sleep. Remember to breathe diaphragmatically, and if you're new to this, you can start with simple cyclic breathing, then move on to box breathing, alternate nostril breathing, and then on to 4-7-8 breathing. If those don't work, remember, give progressive muscle relaxation a try, and if you do wake up feeling tired, Wim Hof breathing can get you a better start to your day. If you want to fall back to sleep even faster, I'd recommend pairing these breathing exercises with some mental techniques to help focus your mind in the middle of the night so you can get the rest that you deserve. I've got a full breakdown of the best mental techniques for falling back to sleep, so I highly encourage you to watch that video next. If you have any breathing techniques that you use to fall back asleep or just calm you down, let me know in the comments below. This is Dr. Michael Bruce, the Sleep Doctor, wishing you sweet dreams.